Since 2021, $1.6 million in grant funding has supported projects designed to promote trust and build a more equitable health system through the Building Trust Advancing Health Equity program. One Brooklyn Health is one of the institutions putting this mission into practice.
One Brooklyn Health is a safety net hospital that's serving Central Brooklyn and East New York. Over 90% of our patients receive Medicaid and or Medicare, and the population is overly Black in a historically and currently marginalized community. This results in a 13.5-year shorter life expectancy compared to areas in Manhattan. This curriculum was created to empower trainees and staff with the knowledge and skills to impact health outcomes beyond the biologic model of disease. There's a lack of systemized interprofessional training that enables health professionals, including internal medicine residents, to be able to have the skills around trust building, leadership, and organizing to really go deeper into more trustworthy relationships with the communities they serve.
We've been for years training clinicians and just general public health professionals in how to advocate for the betterment of their patients and their communities. And we've been doing this in different shapes and forms, but this was a really unique opportunity to work with the community in Brooklyn to build a program together.
We had an agreement very early on that the old way of hospitals dictating to community and just prescribing, not having much of the community's voice in the exam rooms and thinking more about the care side. So we reached an understanding that there needed to be an inside-outside strategy.
So I've worked at the hospital since 2014. And one of the things that I saw was there's a disconnect between some of the doctors and the patients that come in, just because they don't live in their neighborhoods. What I saw was residents, the newer doctors that are coming in, starting to really understand what's going on that they didn't understand before.
As a side effect of the things that we are doing, especially bringing community partners in, was the development of better trust and understanding between them and the local actors, like local civil society organizations and community members. But the other thing that was happening along the way is truly they took this training as an opportunity to develop their leadership.
I was very involved with a component of the curriculum with this concept of story of self. It's this idea that to create a movement, to do advocacy, to create teamwork, to address particular problems related to health, we need to be vulnerable enough to share part of our story, to describe how we got to the positions that we're in. Only when we're able to do this, to practice that sort of radical vulnerability, are we able to convince folks that we are in it for the right reason.
The curriculum focused a lot on transformational leadership, community health. I learned how to include everyone and listen in to what their concerns are. We learned on how to navigate those difficult conversations and problem solve as a whole and make people feel like we're calling them in versus calling them out. I plan on continuing to apply the knowledge that I gained from this program by including this in nursing leadership development with a lens of health equity and inclusion. I plan on doing some mentorship and advocacy for our patients and our staff, really broadening what I'm doing and stretching it out into the community, because that's what we're really here for.
Sometimes you have preconceived notions of who people are from other countries and how they view me or view the people in the neighborhood around me. And it wasn't what I thought it would be. So you had to kind of remove judgment of what you expected someone to think about the patients or what you expected someone to see that, they deep down, they really do want to help, and just need to understand who they're dealing with.
Our goal is to integrate elements of this curriculum into ongoing professional development programs so that it becomes a core component of medical education and healthcare training. We were able to include our executive suite in one of the sessions where we were able to focus on the calling in framework, and that has led to this deeper commitment of being able to roll that element out system-wide.
It was so important that we begin to have projects like this so that we could improve the trust that exists. The only way we're going to improve that, we believe, is through the residents playing a greater role in the care and in the design and the models of care that exist in the community.